Welcome back to Inside South Florida. If you suffer from sleep apnea or know somebody who does, listen up. Here is Dr. Noah Schreibman with what you need to know about sleep apnea. Dr. Schreibman, it is good to have you on the show, and you've brought your stethoscope in case something goes horribly wrong in the next 8 minutes. Thank you for that.
My pleasure.
Sometimes I just fall down, so it's good to know I'm in good hands. All right, we're talking about sleeping. Crucial, hugely important. We're going to get to sleep apnea pretty soon, but let's start with the sort of most general question. Is there a number, a magic number of hours of sleep a night we need?
There's no magic number, but most of the experts will tell you that you will function at your optimum level, getting at least anywhere between 7 to 10 hours of sleep a night.
Who on earth can get 10 hours of sleep a night?
Unfortunately, very few in modern society, but interestingly enough, the two groups of people that need it the most are adolescents and the elderly.
Okay, so perhaps they can. I mean, maybe the elderly sort of march to their own drummer, maybe they can sleep a little more, but people that are working and waking up early and have kids and stuff, so, okay, let's say you get 7. Does it have to be like 7 solid hours with REM sleep in there? Because then what about if you're waking up in the middle of the night? That comes into play too, right?
Well, in theory, you always want to have as solid and as consistent a sleep as possible. You know, the constant waking up, falling back asleep, waking up, falling back asleep, which are seen with a lot of common sleep disorders, are things that we'd like to eradicate.
Let's talk about sleep apnea. I didn't know this until you just told me a few moments ago that one group that's particularly sort of like a high, I guess, likelihood of getting sleep apnea, or maybe more prevalent, is the elderly. Especially
in South Florida, where we have such a vibrant elderly population, there is a big misperception that sleep disorders in the elderly are just because people are getting older, but a lot of problems that the elderly have with their sleep are easily treatable, and sleep apnea is one of the most prominent of those. It's very underestimated in the elderly and very underappreciated in the elderly, both by patients themselves as well as the medical community.
From what I know about sleep apnea, I know there's a few different reasons why it can happen. Talk to us about some of the warning signs, symptoms, not just for the person who's experiencing it, but from the person sleeping next to him that's maybe watching it happen, right?
Yeah, we always joke about sleep apnea in the office because it's one of the few medical conditions where the spouse makes the diagnosis. My husband looks like he stops breathing at night. My husband is snoring like crazy. I have to leave the room. He wakes up gasping for air, panting, sweating, and these are sort of a lot of the clues that we see. The patient themselves, him or herself, that person doesn't know about their own snoring intensity or their own sleep quality, but the things that they can tell us is they'll say to us like, "Doc, no matter how much I feel like I'm sleeping, I'm waking up exhausted. I'm driving to work or I'm driving to the store and I feel like I got to pull over, because I'm dozing off. It takes me 5 cups of coffee to get through the morning. It'll be mid-afternoon, half an hour will go by, I'll wake up again, and where'd the time go?"
Right.
These are the things that the patients can tell us, but the earliest clues that we get are usually from the patient's spouse.
I would imagine, I'm guessing that as you just said that, viewers are probably going, "Oh man, that's me, that happens to me." Is it, people can have some of those symptoms that you're talking about, like during the middle of the night, like waking up gasping, and not remember it, right? In the morning. Especially
the awakenings. A lot of times we'll ask people, "How many times did you think you woke up during the night?" And people say, well, 3, 4, and then we'll actually do a whole dedicated sleep study in one of our hospitals, and literally like 100, 200, 300 mini arousals through the night. Man. And you may fall right back asleep after it happens, but again, there's a big dichotomy between how many times a person thinks they're waking up versus how many times they actually are waking up. Okay, so you're waking up 100, 200 times a night. What's happening physiologically that's causing you to wake up? Physiologically, what's happening is that the airway is closing off at nighttime. When a person goes to sleep, that person's muscles in the back of their throat and their upper airway, those muscles go to sleep as well. So the muscles have a way of sort of clumping together, causing a very narrow passageway for air to get through. What happens with sleep apnea is that so little air gets through, hence the snoring sound, but so little air gets through that a person's oxygen levels will actually drop in their bloodstream to dangerously low levels. The brain senses that. The brain has to do something to get the oxygen levels back up. So what does the brain do? It triggers you to take a deep breath, and it triggers you to wake up and take a deep breath. Once you take that deep breath, those oxygen levels may go right back up, Hence, the brain puts you back asleep again, and the cycle can go on
Wow.
over and over and over again through the night.
Yeah, and it's worse if you sleep on your back?
There are in a lot of patients, there is a positional component to it, but in all truthfulness, sleep apnea can happen in any body position.
Yeah, and it's not just if you're overweight and if you snore, right? Like thin people who don't snore can have it?
Correct. Especially, I mean, I must have 20 women in my practice that weigh about 80 pounds soaking wet that have clinically significant sleep apnea. It has as much to do with the anatomy of one's airway as well as overall general body shape.
Okay, so there's CPAP, there's surgery. What are some treatments? Somebody comes to see you, what happens?
Somebody comes to see me and they have some of the warning signs of sleep apnea. The first step is to do what's called an in-house or in-hospital sleep study, which is an overnight monitored test where a person is hooked up with a lot of various electronic leads monitoring various things. Electrocardiogram leads to check out what their heart is doing. Oxygen probe on their finger to check their oxygen levels out. We'll put a microphone next to their lips to listen to them snore. EEG leads on their head, which are leads that measure brain waves and can tell us what phase of sleep somebody's in. And then obviously after we put about 20 wires on somebody,
you say, go to sleep.
We ask them to go to sleep. And it actually does happen.
Right.
The test is continuously monitored with a technician. And if it turns out while the test is going on that somebody has clinically significant sleep apnea, and what I mean by that is that you're seeing the oxygen levels go down, you're seeing the disruptive sleep, and you're seeing the person wake up, the technician, there are various treatment options that can be done right there during the sleep test to fix the problem. Mm-hmm. And that's what you were alluding to with what's called CPAP or BiPAP mask. CPAP stands for continuous positive airway pressure, which basically is a mask hooked up to a breathing machine where the machine is actually pushing the air into you when you sleep at night, and the pressure being forced into you, just the pressurized air is sort of keeping the airway nice and open.
As we're unfortunately out of time, but the last thing I want to leave people with is, and I don't want to scare anybody, but this is pretty serious, right? Like, I know some people feel like, oh, I have sleep apnea and I snore, big deal. But I mean, you could die from this, correct?
What we tell people is that there are two main reasons why we think that being treated is important, and we divide those two categories up into quality of life reasons and medical reasons. Okay, quality of life reasons. If you have sleep apnea that's not being treated, people complain of always being tired, can't concentrate at work, can't concentrate or focus on what they want to do. If you just imagine, it's like a chronic state of sleep deprivation, so people always are irritable. Spouses, friends say they're horrible to be around. Increased risk of car accidents, because if you're driving when you're constantly sleeping, so you can hurt not only yourself, you can hurt other people. So those are the quality of life reasons. Okay, other side, medical reasons why it's important to be treated. Sleep apnea, untreated. Increased risk of heart disease, increased risk of high blood pressure, and actually a 3 times increased risk of stroke compared with the general population. That's the bad news. The good news is you diagnose somebody with sleep apnea, you treat them successfully with one of these modalities that we mentioned, that person's risks of those different medical conditions plummets significantly.
Fantastic.
That's why it's important.
And as we say goodbye, if people want to ask you questions or come to you for an appointment, how can they best find you?
I'm always working. You just get in contact with West Boca Medical Center and we'll be more than happy to see you.
You are always working. Like I said, you even have the stethoscope with you right now, just in case something happens. Good to see you, and I hope everybody gets good sleep after learning about this stuff, important stuff.
I hope so too.
Thank you.
Thank you for having me.
You got it.